This is Robert Kraft, and I'm coming to you live on SNNLive, and we're here at the SeeThruEquity and the Brewer Group's second annual Innovations Investor Conference 2016 in Miami, Florida. With me right now is Shital Mars from Progressive Care. The symbol is RXMD. Shital, welcome to SNNLive.
Thanks for having me.
It's a pleasure to have you. So for our audience, let's get an overview of the company.
Okay, so Progressive Care is a health services company that specializes in the provision of prescription pharmaceuticals. We were established in 2005 and we reverse merged in 2010 to become a public entity. We also are not just a retail drugstore, so we're not exactly analogous to a CVS or a Walgreens. We do retail pharmacy, but we are so much more than that because we offer a lot of services that relate to that. We offer healthcare services, MTM, durable medical equipment. We do custom compounding. And so our goal is to try to bring healthcare services, unify all the aspects of healthcare, and bring it under one roof.
Okay, so let's start from the beginning. Tell me, how did this company come to be? Where was the idea developed? Can you comment on that?
We have a couple of partners that in 2005 came together to start the company. They opened it just as a traditional retail pharmacy. People come in, get their prescriptions, pick up soap and everything else, and go home. As the market in the pharmacy industry has changed and as regulators have changed, we have adapted. That's one of the best things about our company is that we constantly are staying ahead of the trends and adapting to new changes and new developments in the market. So when PBMs are constantly constricting reimbursements, we don't rely on just dispensing generic or brand pharmaceuticals. We started diversifying into doing specialty pharmaceuticals, specializing in HIV/AIDS, Hep C, cancer medications. We also do compounding and custom compounding, which is the market for that is growing nationally. But we also are understanding that all of these trends will have a peak at some time as well. So we're even going further than that and developing our company further than that.
Okay, so I want to know how it works. You said something about unification of the hospital, the doctors, and the pharmacy. How are you bringing it all together?
One of the drivers of healthcare costs is the fact that there are inefficiencies in the healthcare delivery process. Only 20% of patients take their medications properly. They go to different doctors, they go to different hospitals, records aren't kept in any kind of uniformity. And so one doctor will prescribe one type of blood thinner, they'll go to an urgent care and get another type, and all of that comes to the pharmacy. We are actually the best place to link them all together because most people only go to one place for their pharmacy needs. So we know what drugs they're taking. By bringing the patient to us, we then can communicate that back out to hospitals and caregivers and insurance companies and doctors and let them know this is the patient. They're not being able to be compliant with their medication therapies, so it's important to prescribe a different one, to understand their home situation, to revise what kind of therapies you are thinking about offering them. So it's important that we bring everybody together through us, and because we're that source of uniformity, we're that community keystone, it helps us stay abreast of what they're going through, what the patient's going through a lot better.
Okay, so how are you guys actually doing that? I mean, do you have somebody in place to go and meet with the patients at their house so you make sure that they take it? I mean, how does that work?
Actually, we do.
Okay.
We have a team of over 30 dedicated individuals who are specializing in anything from just customer service to creating the custom compounds to contact the doctor. We speak over 6 languages in our pharmacy: Hebrew, Russian, German, French, Creole, Spanish. We speak everything. And so we actually notice that a lot of our patients are in impoverished areas. They don't have access to transportation. They don't have buses. They can't get to the hospitals. So we noticed that they're having trouble staying adherent, staying compliant with these medications. And we learned this when we started getting into HIV/AIDS in that community. It's a very sensitive community. And so we decided to go out and go to their homes and find out what's the obstacle. So we started sending a nurse there. We started sending a licensed healthcare practitioner, and noticed that sometimes the reason that they're not taking medication is the person's not ambulatory, which the doctor doesn't know because he hasn't seen them in 6 months.
By ambulatory, what does that mean?
Able to walk around, so they may spend some time in in the living room 90% of their time, sitting in the living room with a nurse that comes 3 times a day, and they can't get to the kitchen where all their medications are, and the doctor doesn't know that. So we go there, see all of this, address it with the patient and the caregiver, because that's what's most important, getting the health care to them, and then going to their doctors and saying, look, they might need a wheelchair, they might need a walker or a bath chair or something to help them get moving and help them get access to their health care.
Is reimbursement, who's paying for this?
Right now we have, we accept all insurances, so Optum, Medco, CVS, Caremark, they're their primary payers. We also have Medicare, some straight Medicare. But honestly, most of the services we have to provide free of charge, because PBMs don't cover it, and patients don't have the money to pay for it. And we believe that by offering these services, we improve our standing, our reputation in the community. We help the doctors. We become that leader in the community for doctors, so they want to choose us because we're helping them and their patients. And we're also viewed more highly in the eyes of Medicare and Medicaid because we're offering these services, and that helps us stay in network, that helps us increase our reimbursements, that helps us get things like bonuses at the end of the year where they're looking at our efficiency ratings and whether we're staying on top of our patients and their compliance. So it works out very well, even when it's just coming from the PBMs.
Okay, I also have to know is what markets are you currently serving? We're in the U.S. or in globally? Where are you at?
We are a U.S.-based company. We are in North Miami Beach. We have a facility there that's doing about 15,000 prescriptions a month. We're currently servicing, most of our patients are in Broward and Dade counties in South Florida, but we are in the process right now of getting licensed in all 50 states. We're doing them in batches. We started with New York, New Jersey, Pennsylvania, Connecticut, Texas, these kinds of states, so that we can now deliver this healthcare service all across the nation, because building a national brand is very important for stability and longevity in the future.
And what's your background? How did you get into all this?
I studied economics and math in college, and then I got connected with one of the original owners of the pharmacy, and he brought me into his broker-dealer in 2008, and I was the chief operating officer there. And then in 2009, as they were engaging the reverse merger process, I did a lot of consulting work for Pharmco and Progressive Care. 2012, they hired me as their chief operating officer, and as of January, I'm the chief executive officer.
Well, congratulations. And also, so we're in 2016. It's the middle of the first quarter. From what you can tell me, what are some of the growth drivers and goals and milestones for the business?
Our primary growth driver right now is marketing the compounding business. The reimbursements on that are growing nationally, so we're trying to take advantage of everything that's going on in that market. We completed a major milestone in 2015, which is eliminating all of the age debt from our balance sheet. So we now have no encumbrances going forward and executing on our agenda. In 2016, we want to be delivering 21,000 prescriptions per month. We want to be licensed in all 50 states. We want to do $16 million in sales. And these all sound like ambitious goals, but they are very doable. We have a great team that can execute on all of this.
So where can our audience go and find more information about Progressive Care?
Well, we have our website, progressivecareus.com. We also have pharmcopharmacy.com, and you can get all of our disclosures, all of our press releases, and financial filings on OTC markets.
This has been Robert Kraft, and I'm coming to you live on SNNLive, and we're here at the SeeThruEquity and the Brewer Group's second annual Innovations Investor Conference 2016 in Miami, Florida. With me again has been Shital Mars from Progressive Care, the symbol RXMD. Thank you again for coming on to SNNLive.
Thank you so much for having me.